Greetings, everyone. Welcome back. This is the Real Work Show, and today we have the privilege of interviewing a healthcare supply chain specialist. What the heck is that, you may ask? Well, we're going to find out in 2 seconds with my friend Brian. We're going to be doing in this segment what we call the lightning round, and the lightning round, I say, is the video format, the interview format for those with a low attention span like myself. So basically, in the lightning round, we do 15 questions in 5 minutes and try and learn as much as we can, in this case, about what a supply chain specialist in healthcare does. The Real Work Show is really all about exposing you to people that love their work. So if you haven't connected with work you love, we want to help you to understand what work they do, and who knows, it might be a connection for you. So that's the plan for today. Brian, how's it going?
I'm good. How are you, Mark?
I'm doing fantastic, and I'm looking forward to this because you happen to be in an area that's interesting on 2 different levels. First of all, supply chain is hot. People know supply chain's hot. Supply chain's interesting. And healthcare, especially in COVID times, also a hot topic.
Strange times.
Strange times indeed.
Strange times.
Are you ready for the lightning round?
As ready as I'm going to be.
Fantastic. Fantastic. I'm going to start the clock, and we'll get going. Sound good?
Great.
What drew you into work in healthcare as a supply chain specialist?
So healthcare was never a field that I considered myself working in previously, and I didn't really think about opportunities outside of like your doctors and nurses in healthcare. So once I found out about it, it just opened a whole world of possibilities for me. So there was a lot of learning.
Awesome.
Available.
What do you like most about the job?
The variety of the projects that I get to work on. So I'll work in like oncology one day. I could be working with our distribution center another day, working on supply chain issues, that kind of stuff. So huge variety in tasks.
Awesome. And what's one thing that causes stress in your work?
Trying to find products to use when other products are on back order. That's a big one. Yeah.
Gotcha. Probably a hot topic during these days, I'm sure.
It's big, yeah.
So does your work make anyone's life better? And if so, who and how?
For sure. So I work with hospitals and suppliers to try and get products to hospitals when they need them. So if you think about people going in for surgery, that kind of stuff, the products that are being used in those surgeries likely have gone through, well, they would have gone through a supply chain organization at some point along the line.
Okay. What's one way that COVID has impacted your work?
So we touched on it previously. Supplies are really tough to come by. So you have to look under every rock to try and find something that'll work for your hospitals.
Right. So in a typical day, working as a supply chain specialist in healthcare, what are 3 activities that we might find you doing?
So as a supply chain specialist, I do a lot of implementation work. So if we have new contracts for catheters, something like that, I work with our hospitals and our suppliers to implement those contracts. That's one thing. Finding alternative products to use when certain products are on back order, like masks were a big thing at the start of the pandemic. That's another task that I do. And I also work with our hospitals on product issues that they might have as they arise.
Okay. One thing that you do to continuously improve at your job?
I would have to say remembering things that I've done. The same problems do tend to come up, maybe in slightly different situations, but remembering things that worked in the past is essential to resolving issues effectively going forward.
Okay. What kind of person would be great at the work that you do?
You'd have to be a generalist, I would say. You have to get involved in so many different areas of healthcare and supply chain to do it effectively. So you really have to be flexible.
Okay. How well did your education prepare you for the work that you're doing?
I would say that actually working in the field has done a lot more for me than formal education. But things like, university degrees, they're great to teach you how to think differently. So, I wouldn't say don't pursue education, but the specific tasks that I'm doing are really learned on the job more so.
Okay. What kind of person would not do well at your work?
I would say very extrinsically motivated people. When you talk about supply chain, if everything is going smoothly, perfectly, you could say,
Yes.
your customer shouldn't really know you exist. So,
Okay. If we weren't having this riveting interview tonight, what would you be doing?
I'd probably be eating dinner about now. Yeah,
I feel bad now. I feel bad.
that's okay.
At the end of a day working, doing the work that you do, what's a sign that you know you've had a good day at work?
If I can, so it is heavily project based. If I can finish a project
Okay.
or at least know that I've moved it forward, if you can move projects forward at the end of the day, that's
Okay.
a good day.
So I'm interested in doing the kind of work you do. Maybe I'm just finishing my education. What's a piece of advice you would give me in terms of pursuing that kind of work?
I would say if you get into a supply chain organization, for me, what was key was trying out a bunch of different roles within the organization so that you know how to work internally to speed up the process of getting different tasks done.
Okay. If I start working in your team tomorrow, what's one thing that might surprise me about your work?
Probably the degree to which you play a facilitator role, not doing tasks, but coordinating a lot of tasks.
Okay. Awesome. I have good news for you, Brian. You survived the lightning round.
Amazing.
It doesn't happen all the time.
Yeah.
Not,
Fantastic.
not true. But we've never lost a patient. So
Great. Well, hopefully some of that's usable anyways.
absolutely, absolutely. No, thank you very much. And you actually kept it within the 5 minutes too, with the help of a little editing. I'm just kidding. You did great. So I think this will be really, really useful as we started off at the beginning. You know, you've got experience in supply chain and specifically in healthcare. Interesting areas on both fronts, and I'm sure just this little glimpse into your work has been interesting for people. So for everyone that's watched this video, we're going to be going into a longer format discussion with Brian in 2 minutes. So check out that one if you're interested in healthcare work, in supply chain work. Tune into that one as well. If you've got a longer attention span than the 5 minutes this was, that'll be really interesting. So be sure to subscribe and check out more interesting interviews with people like Brian. Thank you.
Thank you, Mark.